Okay, good afternoon, everybody, and welcome to the City of Toronto's 2019 COVID-19 briefing for Friday, April 17th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and with us to answer any questions you may have is City Manager Chris Murray. On the line, we have Marianne Bedard from Shelter Support and Housing, as well as Paul Raftis from Senior Services and Long-Term Care. As well, Chief Pegg is also here should there be questions for the Chief. Mr. Mayor.
Well, good afternoon, and thank you, Brad. COVID-19 has taken a devastating toll on many businesses, finances, and of course on the finances of many of our residents. The City of Toronto is no different. Almost overnight, we saw dramatic revenue drops at the TTC, where ridership, for example, dropped 80%. We saw revenue drops in other areas, from permit fees to land transfer taxes to the Toronto Zoo. At the same time, we have been waging war as a city against COVID-19, incurring tens of millions of dollars in additional costs to respond to this unprecedented crisis and tragedy and prevent a larger catastrophe. That has meant, in many cases, significant added expense in areas including cleaning supplies, overtime, and helping the homeless. And throughout the war on the virus, the city has continued, of course, to provide all of the essential and critical services that everyone relies on, including frontline emergency services. City finance staff have been working hard throughout the crisis to understand the financial impact on the city, which is the first step to solving this problem. You have to quantify the problem. They have determined that the COVID-19 pandemic is costing the city government $65 million a week, most of that being in the lost revenue that I made reference to, but some of it being in the added expenses we've had to incur. The largest driver of this burn rate, as you'd call it, the $65 million a week, is the more than $20 million a week in revenue that has not come in to the TTC. We have kept the TTC running so that frontline healthcare workers and all essential workers can get to work and to get home. And to date, we've maintained a consistent number of trains and vehicles, even with dramatically reduced ridership. And the reason that we've done that is so as to avoid overcrowding on those vehicles, and that because if we were to allow the overcrowding, it would go against the very physical distancing that we're talking about for everybody in their day-to-day lives in the city. The weekly cost of the pandemic is only part of the story, and I think it's important for everyone to understand the current situation and where it could be going. And a lot of this is based, as with a lot of things you hear these days, based on projections, and with none of us knowing exactly the timetable that we're operating on. The finance staff, and led by the city manager and our chief financial officer, have crunched the numbers and have determined that a 3-month lockdown and a 6-month recovery period, during which time neither revenue nor expenses can be expected to return quickly to normal, that's in the recovery period, between those two periods, it could end up costing the city in total as much as $1.5 billion, and that is the best case scenario. Just to offer a brief explanation as to how you get to a number that big. If you take the $20 million a week that I made reference to in lost TTC revenue and you run that out over 3 months, the 3-month cost then in terms of lost revenue is $305 million. And if you run it all the way out, the rest of the time for the full 9 months, it totals $940 million. And that even makes some assumptions about gradually increasing ridership as the economy is allowed to open again. And while the length of the lockdown and recovery are something we're desperately trying to avoid, in other words, we're trying to make sure that by following Dr. Davila's advice, we make those periods of time as short as we possibly can, we have to go on the assumption that they're going to last as long as that and possibly longer, but we're certainly hoping that they won't. And the cost of a 9-month lockdown, if it goes longer, and a 12-month recovery period after that would cost the city $2.76 billion by the end of this year, and of course more to come in 2021 because the recovery period would last into the new year. I believe the vast majority of Toronto residents are getting the message that they need to stay as close to home as possible. They need to avoid close interactions with others and not go out in public, especially if they have symptoms or have been diagnosed with COVID-19. Not only will this save lives and avoid the terrible situations we're seeing in New York City and elsewhere, this, I believe, will help us to end this pandemic as soon as possible and reduce the financial impact on the city and all of its residents and businesses. That is why I'm pushing so hard for people to listen to the doctor's advice, the advice of our professional public health officials, because I know it is the right thing to do. It will protect not only your own health, it will not only protect your family's health and that of your neighbors, it will protect the city's health in the context of the city's finances. The shorter the period of time that we're dislocated by the pandemic, the less the damage to the city's finances. But even assuming we beat COVID-19 as soon as possible and move to restart the city as quickly as we can, we are looking at as much as $1.5 billion financial impact by the end of this year. This is one of the greatest financial challenges the city has ever faced, and so we will have to rise to that challenge. I can tell you that I'm ready to lead in that process in a sensible and balanced and responsible way, working with my colleagues on City Council and our excellent city staff. But make no mistake, while we are scouring the city government for savings while still maintaining all the essential and critical services that people rely on in the city and that we're providing today through the pandemic, we will need help from the other levels of government. I'll have more to say on expenditure management measures in the coming weeks as we work with our city staff colleagues to identify places where we can do better in that regard. I've been very clear with the other governments about this already. This will require assistance from those governments in substantial amounts, especially taking into account the constitutional limitations placed on cities, including those the size of Toronto, which itself is bigger than many Canadian provinces. I have been speaking regularly with both the provincial government, including Premier Ford, Finance Minister Rod Phillips, and Municipal Affairs Minister Steve Clark, and with the federal government, including the Deputy Prime Minister Chrystia Freeland, Finance Minister Bill Morneau, about these issues. And the mayors of Canada's biggest cities have been sharing information and meeting with government officials, including our most recent meeting this afternoon with the Deputy Prime Minister of Canada. During the course of today's meeting, I spoke on behalf of my colleagues in outlining not only the crucial role that cities play in dealing with the pandemic, but also the role that cities, including Toronto, led by Toronto, I hope, will play in successfully relaunching not just our city's economy, but the nation's economy. I will be ramping up those conversations in the coming days. This is a national issue, and it is a major provincial issue, in addition to being an issue for the City of Toronto and all of the cities in Ontario and in Canada. Cities are on the front lines of helping to combat COVID-19, and they will be on the front lines of rebuilding and recovering our economy. Our city led Canada's economy before this crisis, and we will have to lead it again. We are Canada's business and financial capital, a growing tech hub in all of North America, and a top 10 global financial center. Our GDP growth was significantly outpacing the national average before the pandemic. The Toronto region's GDP has grown by an average of 2.4% annually since 2009, compared to a national rate of 1.8%. Last year, we were part of the biggest employment jump in Canada in 40 years. 2 months ago, and I know it seems longer in terms of all that we've been through and all the trauma that people have experienced in terms of employment, 2 months ago, back in February, a stunning 1.56 million Toronto residents were employed. 238 mid-rise and high-rise buildings were under construction, the most of any city in North America, and our city was booming. And that was good for Torontonians, and it was good for all Canadians. There is no denying, however, the devastating impact of COVID-19 on our economy. Statistics Canada reported about 227,000 job losses for full-time and part-time positions in the Greater Toronto Area for March, 400,000 job losses in Ontario, and over 1 million across Canada. The Conference Board of Canada is projecting a total of more than 1 million job losses in Ontario, and that the Ontario economy is projected to shrink by 3.2%. We've been hit hard, but that's why I believe it is so important that we keep moving forward and come back stronger than ever. We know that when Toronto does well, Ontario does well, and Canada does well. The entire country is counting on a strong recovery here, and we want to lead that charge for us, but also for all Canadians. I am determined that we will deliver that. That is why we're working so hard to get through the pandemic, to protect the health of residents, to save lives, and to help businesses. And that is why we're starting to plan very carefully how we restart our great city. We will need the TTC to be able to ramp itself back up to full strength as the economy recovers and restarts. We will need to get shovels back in the ground on major infrastructure projects across the city. We will need a city that works so that people can get back to work. We will need a city which can continue to look after its most vulnerable populations, and a city in which people can once again play and find some joy as health conditions improve. I am convening a meeting next week with the Greater Toronto and Hamilton area mayors to discuss how we can work together as mayors of this region to successfully and smoothly reopen our vital regional economy when the time comes, assisted as that task must be by significant financial participation and assistance from the other governments. Now, before we move to receive Dr. Davila's report for today, there's a couple of other matters I want to update the people on and the media. This morning I spoke to Christine Hubbard of Beck Taxi to hear her concerns about taxi drivers transporting people to and from COVID testing sites. Those people need to receive transportation, but it's also a fair concern to ensure that taxi drivers are kept safe. I totally understand her concerns, and I've asked the Emergency Operations Centre, under the direction of Chief Pegg and Deputy Chief Jessup, to work with Beck Taxi to set up a protocol to protect everyone, drivers and residents, but also to make sure people have the transportation they need. In the meantime, I continue to urge anyone with COVID symptoms to stay home. Do not take transit or a taxi or rideshare. Please stay home. If you're booking a taxi to go for testing, please advise the company so they can prepare for that. There are certain basic precautions they can take in order to make sure they can accommodate that. Secondly, I know that federal officials have now announced that they are planning a virtual celebration for Canada Day on July 1st. As you know, we moved early on, weeks ago, to cancel all city events up to June the 30th. I would expect we will have more to say on Toronto's Canada Day festivities in the coming days, but our focus right now remains on conquering this virus. I've also, thirdly, asked Dr. Davila to provide an update on Monday as to where the city is at in terms of our fight against this terrible virus based on modeling. We're doing well when it comes to staying home as much as we possibly can, keeping our distance, and that has allowed us to avoid a steep increase in cases that we thought might be the case, and it still could be if we take our foot off the gas. But I think we all know that we have much more work to do in fighting this virus, and I think it is important that residents should have up-to-date information, the same information that we have from the Medical Officer of Health, so that you can understand, yes, the fact that we have saved lives, but at the same time that there are still real risks and that this can be minimized by making sure that you continue to make the sacrifices that you have made with our great gratitude, and it's why we're asking you to continue to be involved in this fight. And that is my final point for today. We have come a long way, and it seemed like a very long time. And it has been a very long time. I've said many times it's this much in the context of a lifetime, but when the kids are home from school and when you're cooped up sometimes in an apartment and when you can't go here and can't go there and can't do this and can't do that, it seems like a very long time. But we cannot take our foot off the gas. Still continue to stay home as much as possible. Keep your distance from others outside of your own home. Connect with friends and relatives online or by phone. It's amazing the number of Zoom cocktail parties that are taking place and all that kind of thing. People have made an adaptation to make those kinds of things happen, to stay in touch. This weekend, I'm meeting with senior city officials to talk about how we could go about safely restarting the city. We've had some work already being done by some members of our city council and others, and we're now starting to take that work and pull it together into a meaningful, workable, responsible plan, which will be driven largely by the advice we receive from the people in public health. When we get to restart the city depends on each and every one of us. Every single person out there is going to have as much of a role to play in the restarting of the city as the mayor or the medical officer of health or the city manager. All the efforts that you're making now, all the sacrifices, all the misery, all the pain right now to stop the spread of this virus will determine when we can reopen the city. You know, together over many years we've built a very strong, a very vibrant, a very caring GTHA, and I know that we're going to come back. I know that we can come back, and we want to come back, and we must come back for the well-being of the country, stronger than ever and even more dynamic, so that we can keep the entire province and the entire country recovering as quickly as those other parts can as well. I am going to be putting every ounce of skill, of energy and determination and experience into the task, working with the city manager and the whole team here at City Hall and all the advice we can get to fixing the city's finances, for example, so that we can allow ourselves to once again be on a stable footing moving forward. I'm actually filled with hope about this because we have a great team. The team is already hard at work on this, including every single resident is hard at work by doing the things that people have been asked to do. But even more so, I'm filled with hope because the fundamentals which made us one of the most admired cities in the world, one of the top 10 most livable cities in the world, and all the other places that we rank so high on those lists of cities from around the world, that's all still true. It's all still there. The values are still there that have driven us to be a caring city and to be admired for that caring. So now we've got to get on with addressing these things, and it seems like the finances are more bad news in the context of all the other bad news and tragic news that we've had, but we've just got to get at it. And that's what we're doing here at City Hall. That's what I'd ask you to do over the weekend. Keep at it, keep doing what we know is the right thing to do, and we will emerge stronger than ever in not too long a period of time from now. And on that note, I'll ask our Medical Officer of Health if she will bring us her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 3,145 cases of COVID-19 in Toronto. This includes 2,818 confirmed cases and 327 probable cases. There are 244 in hospital and 97 in intensive care units. In total, I am sad to report that 154 people have now died of COVID-19 in our community. On behalf of my team, I extend sincere condolences to all those affected and wish a speedy recovery to all those who are ill. The province's plan to expand COVID-19 testing, particularly in long-term care homes and shelters, is now underway. And while this is good news, we should expect as a result that our confirmed COVID-19 case numbers here in our city will continue to increase, especially in these settings. While this may be jarring or disheartening, please remember that the more information we have about COVID-19 in our city and in vulnerable settings like long-term care homes and shelters, the better we are equipped to respond and the better we are able to direct our actions. Data is core to informing our response to COVID-19. It is the only way we will understand where and how this new virus is spreading and if our public health measures are working as we expect them to. Our data story is being informed by case and contact tracing reports, testing results, reported symptoms, hospitalizations, deaths, and experiences in other jurisdictions. It is important to understand that in order to identify data patterns and trends, we need good data from many different sources over time. So what is emerging as Toronto's COVID-19 data story? Well, to date, approximately 23% of our local COVID-19 cases have been amongst residents over the age of 80 years. And while the eldest members of our community are most impacted by COVID-19, younger people are also affected. In fact, an estimated 35% of those who have been hospitalized for COVID-19 are aged 40 to 59 years, residents of our city who are in the prime of their life. A further observation that we have made is that approximately 35% of COVID-19 infections in Toronto are the result of being a close contact of a confirmed case. This continues to be the case and underscores the need for strict self-isolation of everyone who is ill and their close contacts. A particular area of concern is the outbreaks we are experiencing in our long-term care and retirement homes. Like you, I am very concerned about the devastating impact of COVID-19 that we are seeing amongst some of our most vulnerable residents. As I mentioned at yesterday's briefing, I appreciate your interest for more information about how COVID-19 spreads and how it's impacting our city and our loved ones. Today, I am pleased to let you know that we have posted data online about outbreaks in local long-term care homes and retirement homes. We will be updating this information every Monday, Wednesday, and Friday. Staff are working tirelessly to keep our loved ones safe in long-term care and retirement homes. In addition to the measures already in place, new provincial measures, including increased testing of staff and residents and restrictions for staff to only work in one facility, will help reduce the risk of infection. The other congregate setting that is of great concern for us, is Toronto's shelter services community. Today, my team is posting aggregate data regarding shelters and will post a more detailed analysis online on Monday. Staff in these settings are also working diligently to ensure good physical distancing, to expand shelter capacity, screen clients as they enter the facility, reinforce good hand hygiene, and increased cleaning of high-touch surfaces. The availability of more shelter facilities and recovery centers is very important to keeping infections down and to help those impacted by COVID-19 to recover safely. Before closing, I would like to take a moment to address a recent concern shared by taxi drivers in our city who are essential workers. They are worried about being exposed to COVID-19 from infected riders who are traveling to and from hospitals or COVID-19 assessment centers. For anyone who is infected with COVID-19 and self-isolating, I will remind you, the only reason you should be leaving home is to go to a scheduled healthcare appointment or to hospital. If you must do this, in addition to what Mayor Tory addressed in his remarks, I offer the following advice. If you must go out of your home when you are COVID-19 infected, we ask, do not use public transportation, and where possible, if you're having to go to that healthcare appointment or to hospital, we ask that it is best if you drive yourself. If driving yourself is not possible, we would ask that you arrange a ride with a friend or a family member. And if you are unable to arrange for a ride, then it's best to take a taxi or a car service. In either case, please ensure that the windows of the car are open. We would ask that you sit in the back seat and wear a mask, a scarf, or a face covering over your nose and mouth. If you are traveling by taxi or car service, record the company name and the license plate. And of course, if you need urgent medical attention, call 911. In closing, I would like to thank you for your interest in understanding how COVID-19 is impacting our city. As always, we will continue to do our very best to share information as it becomes available. In the meantime, I would ask that you remember that the most important thing you can do, is to continue to stay home, stay safe, and take care of each other. Thank you.
Thank you, Dr. Davila. We'll go to questions now, starting with Austin Delaney from CTV News. Go ahead, Austin.
Hi, Doctor. Thanks for taking my question, and I understand you're under a lot of pressure, so I understand where this question comes from. It's just how did that slip through the cracks with Toronto Public Health that people were told just to take a taxi? And in your remarks, I didn't hear you say, tell the taxi company, I'm sick, I'm a probable cause. That's my question.
So thank you, Austin. We've had this question come up several times over the last several weeks, and in fact, our advice has been consistent. And you're quite right. You should advise the taxi company. The idea is to do the best you can to prevent the spread of infection. We recognize that people who have COVID-19 infection will from time to time need to go to a scheduled healthcare appointment or perhaps to visit hospital for non-urgent type situations. Clearly, if they need urgent medical attention, then 911 is the best way to go. So you're quite right. people who need to take a taxi or car service in order to get to hospital, assuming that there isn't another method for them to get there, should inform the taxi or car service and do the best they can, as I've just provided in my remarks, in order to prevent the spread of their infection to somebody else.
By way of follow-up, Beck Taxi said when they were talking to the mayor, there was some discussion that maybe the taxi service could become a service for just taking people to these clinics. They would ask for volunteers. Is that something that's on the horizon?
Well, I will just say and follow up to those discussions today and to try and address the concerns that the Medical Officer of Health and people in the public, including Beck Taxi, have raised. We're trying to develop a protocol which would have it as much more of a routine that when, for example, somebody was leaving an assessment center, having been there to get a test, that a taxi would be called and that there would be a group of taxis which would be quite prepared in a number of different respects to expect to be taking people that had some possibility of having the virus or actually had been confirmed to have it. So we're working on that between the Emergency Operations Center and the taxi company, because the objective here has always been the same and it hasn't changed, which is to make sure that people who need transportation to and from assessment centers and hospitals get it, but that at the same time the drivers who are providing that transportation, whoever they are, but including in particular taxi drivers, are kept safe and healthy at all times.
Okay, thank you. We'll go to Francine Copeland from the Toronto Star. Go ahead, Francine.
Hi, I have two questions. The first one is for Dr. Davila. I wondered, I know you mentioned something about more information becoming available on Monday, but are you in a position to tell us how many people in shelters have now been diagnosed with COVID-19 and how many shelters are affected?
So Francine, I don't have the latest figures for today, and I do apologize for that, but I expect that we will be seeing a posting, an aggregate posting later this afternoon, and we'll have more detailed analyses available online on Monday.
Okay, thank you. And my second question is for Mayor Tory. There were some complaints this week about people receiving tickets related to, using the parks, sitting on benches, and so on. And some complaints that the fines have been set perhaps too high, higher than, a lot of offenses that could be more serious, like driving drunk, for example. Do you think that they've been set too high, or do you think it's proportionate?
I think if you take into account the fact here we're dealing with something that potentially has life or death consequences, that the fine has been set at such a level, and by the way, it had to be approved by a judge, such that it sends a message to people that this is really important. If you are going to defy the law, but also defy common sense by standing in groups or forming up groups in public places when we know for a fact that there could be someone standing in that group that is unknowingly carrying the virus and spreading it to those other people, that it is meant to send a message to say this is conduct that is deeply frowned upon by the city. And I think most people support that. There's a simple way to stay away from the fine, which is not to do the things that result from a conviction under the bylaw, and it's fairly straightforward. It says don't get closer than 2 meters or a hockey stick or 6 feet to another person unless you live with them, and don't use some of the recreational facilities that have been clearly closed off with tape and signage and fencing and all kinds of other things. And so I'm not hard-hearted about these things at all, but I just do understand the crucial difference that this kind of behavior makes in us saving lives and speeding up the process of getting to the promised land where we're going to have the city back. And that the very few people who choose to disregard that, I think, are earning themselves a fine. And, that's all I can say.
Okay, thank you. We'll go to Matt Bingley now from Global News. Go ahead, Matt.
Mayor Tory, I'm just wondering, you were talking about all the meetings that you've been having with different officials. The city can't run a deficit. Has that been something that you've asked about maybe being allowed to do so?
It was raised at a meeting that I attended of the large urban mayors of Ontario with the ministers of finance and municipal affairs, and they didn't respond. I didn't expect they would, because it was raised without advance notice, and it was raised in kind of one of those conversational exchanges that we had, a group of mayors with the officials. I will just say to you that I don't think that the notion of cities, including Toronto, being allowed to run a deficit really represents any kind of a meaningful solution for this, because in the end, while you could borrow the money to finance that deficit, let's say it might be $1 billion of that kind of order of magnitude, we still have to come up with the money from somewhere to get it, and you can't attach it to the long-term debt of the city. And so I just think what's going to be required is exactly what I said, which is the assistance of the other governments that are going to have to step in and decide that cities are the economic engine, they are the service delivery vehicle for many, many things that are done for people, and that our financial health has deteriorated only because of this pandemic, and that it is appropriate for those other levels of government that have much more diverse sources of revenue than us to step in and help us with those problems.
When it comes to that, though, I guess the city can't attach it to their debt load, but you're asking another level of government to basically on-pass this, so the citizens are still, holding on to this debt one way or another. So what is the best solution for, where is the bottom of the well when it comes to creating debt for different levels of government?
I understand that there is only one taxpayer, and I understand that all governments draw from that very same well, but we also know that the Government of Canada, as a national government, has resources at its disposal, a means of raising money, and frankly at a lower interest rate than any of the other governments, notwithstanding Toronto's excellent credit rating. And so the message we're delivering to them is that if cities are as important as they are, that this city of Toronto represents 20% of the GDP of the entire country, then it is appropriate that those governments should make an investment in this city in the wake of this crisis so as to help us get back on our feet and help the whole country be strong and get back to creating jobs and economic activity for, yes, Toronto, but for all of Canada. And I think they'll respond to that. We had a good discussion with the Deputy Prime Minister today, and I'm optimistic, as they have on every other front, that they will respond to the challenges being faced by our cities, including Toronto.
Okay, thank you. We'll go to Haley Cooper now from News Talk 1010. Go ahead, Haley.
Mayor Tory, so you just mentioned that Toronto represents 20% of the GDP. So what figure are you looking for from the provincial and federal governments? First provincial and federal. What sort of funding, what amount of funding do you want to see come from them?
Well, we haven't divided it up, but let me put it to you this way. If you look at the requirements for just the rest of this year as being about $1.4 billion in terms of shortfall, we will make lots of efforts to try to contain our expenditures, for that matter, to try and get this pandemic and the recovery period over as quickly as possible within the constraints of all the guidance will be given by public health. But we're expecting that because efforts we might make, and that we have very limited ability to raise money and very limited ability, as we've discussed, to borrow for these purposes, that most of that money is going to have to be made up by the other governments. And they will have discussions, I'm sure, with us and with each other as to how they can help us in that regard, because I'm confident they will, because it is in their own best interest. The major financial beneficiaries, aside from people, of a strong economic recovery will be the provincial and federal governments who collect income tax, corporate tax, HST. They collect all that money. We don't get that. And so if the economy recovers in Toronto strongly, as it should and as it must, then they will be substantial beneficiaries. This would be the best investment they could ever make, investing in cities and investing in the City of Toronto, Canada's economic engine.
And Mayor Tory, revenue losses like you've laid out today make many feel like layoffs are inevitable. So I'm sure there have been meetings and you've crunched the numbers. What is the best case scenario for job loss numbers for city workers?
We've been very focused so far on redeploying workers, because across the range of things that we have to do, the shelters, you saw yesterday that we announced we had redeployed 160 city workers to work in long-term care to make up for the fact that so many who work so hard there are ill right now and can't come to work. And so we're going to make as much of an effort as we can to redeploy workers, and we're going to make as much of an effort as we can to obviously constrain our expenditures. We've learned during this pandemic even that there are ways in which we can use technology to deliver services better. So that is our objective. But, the thing about municipal government is this. We deliver services that are expected by people every single day. The fire department has to come, the police department has to come, the transit system has to operate, the roads have to be kept, the parks have to be kept, and on the list goes. And a lot of that involves people who do that work for us. And so if you say you're going to be trying your very hardest to maintain crucial and essential services, then the people go with those services. And so that's going to be our principal objective, and we'll see how we do, and we'll be reporting to you and to the people of Toronto as we go.
Okay, thank you. Go now to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hi, for the city manager, I know that you had previously said that there were strategies in place to bridge the gap until June 1st. I'm wondering if that's still the case and what the plan is if there isn't cash flow immediately from the other levels of government this summer.
So thanks very much, Jennifer, for the question. So we continue to monitor our cash flow, our liquidity. Right now, we seem to be fine up until June 1st and beyond. But again, I think in terms of getting back to collecting property taxes, which the 60-day period will be up in the next short while, that will help in terms of improving our liquidity. So right now, we don't see it as an issue that is as important as what I think the mayor's just pointed out in terms of the overall revenue shortfall and expenses. So that's certainly where our focus is right now, is to make sure that we are able to identify a strategy with upper levels of government in terms of addressing what looks like a minimum of $1.5 billion shortfall.
Can I add one more thing to that? It's a message that I haven't put out very much, but we're going to have to put it out on an increasing basis, which is that I would strongly urge people, if they are in the same position they were in before, they did not lose their job and their income has remained as it was before, if you can pay your taxes, please do. There's some indication that there are some people who took the opportunity to defer the payment of their taxes, which was really meant to help those who were struggling and who'd lost their job or lost their income, or somebody in the house did. But there are other people where things have not changed, and we're just urging you, so as to minimize the scale of this problem, to please pay your taxes. I know nobody likes paying their taxes, but in the end, that's where the money comes from, to pay for the police and the fire and the parks and the roads and the transit and everything else. And we would urge people who can to please continue to pay their taxes on the normal schedule and not even take the deferral if they can possibly avoid it.
Mayor Tory, just to follow up on that, in terms of minimizing the scale of the impact, should the city be reconsidering projects like rebuilding the Gardner in order to help with some of the financial burden this pandemic is causing?
One of the things that we're going to go through as part of the exercise, I think, as you know, one of the options we looked at is taking some of the funds that were allocated out of the current operating budget for capital purposes and, reviewing that and seeing if there was any of that money that could help us, again, on the theory that we should help ourselves first out of our own problems at the same time as we're calling on the other governments to help us. So that we'll be looking at the capital projects, various of them, to see where there are opportunities to find the kind of money that we need to address our problems. That addresses current capital projects. We haven't begun yet to review the future capital budget. That will come because it's in outlying years as we have to address the length of time it's going to take for us to experience a complete recovery.
Okay, thank you. We now go to Mark McAllister from City News. Mark, go ahead.
Thank you. Just wanted to raise the point. Obviously, we're asking for more money from other levels of government to reach a point where the economy is somewhat stable again, or at least we're back on track with the city. But in projecting some of the shortfalls, are you also looking at the possibility of having to try and find some of the savings elsewhere in some of the programs that the city offers or otherwise? Any cutbacks in any way?
Well, I mentioned in my remarks, I didn't use that word, but I mentioned in my remarks that of course we'd be looking for efficiencies everywhere we could, and that there's even some opportunities we found during the course of the pandemic to use technology to deliver services better and at the same time perhaps deliver them more cost effectively. So of course it goes without saying that as part of good management, our city manager, our chief financial officer, myself, will be looking for every possible opportunity not to alter the services that Torontonians depend upon. They depend on them. They're services that have to be there every day for them, but to find ways to deliver them more cost effectively, and we will make every bit a contribution as big as we can on that. But I also pointed out truthfully that that is not going to total $1.5 billion, and that is why we're going to need the help of these other governments to help us with this unexpected problem that we have. Our finances were stable before the pandemic, and now they're in a situation where we have a problem and we need their help to get out of it.
very quick question for Dr. Davila, and this is something we may have addressed in the very early part of all of this, but recently you haven't been bringing up the number of recovered cases. One, wondering why that is the case, and two, how do you qualify who is recovered and who hasn't recovered?
So thanks for that question. And, you know, those numbers are available. We do post those online. And how recovery is defined actually varies from person to person. So for those who are working within the context of healthcare, they are expected to test negative, and there is a clearing process in order to allow them to return to the workspace. But for most other people, it is generally, you know, members of the general public, it is 14 days after symptom onset that they're cleared and able to go back to regular life.
Okay, thank you. We'll go now to Lauren Pelley from CBC News. Go ahead, Lauren.
This is for Dr. Davila. You were speaking of, as the testing is increased, we will probably see more cases in certain settings. We're also seeing from some of the modeling that Toronto is sort of on a different trajectory than the rest of the province, even right now, before that enhanced testing, where the curve may be flattening province-wide, but Toronto is seeing higher numbers of day-over-day cases. What do you make of that, and do you think Toronto is in worse shape than the rest of the province, and if so, why?
So thanks for that question. It certainly is an interesting one, and I think there are many factors that go into what happens in terms of transmission dynamics and how a virus spreads through a community. But I think there are a couple of important features that distinguish Toronto from many other communities in the province. The first of which is that we're a much larger urban center, and we are much more densely packed than others. So I think that certainly plays a role in respect of virus transmission in our own setting. We also have a significant number of long-term care and congregate settings, and we've seen over the course of this outbreak that those are particularly vulnerable settings and settings in which we're seeing a fair amount of virus transmission. So by definition, we are going, because we have so many of these settings, we are going to see some of that activity happening here, where it might not be quite as prominent in other jurisdictions. But I will say this, when we look at our data here in Toronto, when we look at doubling time, we are seeing increases in doubling time, which means that things are absolutely improving here in Toronto. Perhaps not in exactly the same trajectory as the rest of the province, but certainly moving in the right direction. This being said, we must continue to stay on course with physical distancing, with ensuring that people who are sick with COVID-19 or are close contacts of those with COVID-19 stay in self-isolation in order to continue to see the kind of progress we want to see and in order to get our city back as soon as possible.
One more question, just focusing on the homelessness piece. Looking forward to seeing that data. One issue raised to me by an emergency physician was that right now, a lot of the homeless members of our city don't know where to go if they feel they have COVID because they're not being tested in a widespread way in the shelter system. So they are flooding emergency rooms, and when they get test results, they're waiting there for hours and hours on end in a closed, confined space with what I've heard is a dozen or more sometimes other homeless individuals in the same space. Obviously from infection control, that doesn't seem like a great situation. Can you comment on that situation of these visitors on the ground and if this can be avoided at all?
Yeah, well, I think it's precisely to avoid those kinds of circumstances that the province has introduced, new testing efforts and this new testing plan, which includes more active testing within the shelter settings themselves. This is exactly what we want to see, and yes, it will increase our case counts and it will increase our numbers here in Toronto, but that is exactly what we need, more testing in order to understand what's happening within those congregate settings and to better direct our actions and our response.
Okay, thank you. We'll go to Jeff Gray now from the Globe and Mail. Jeff?
Thank you. Hi, everybody. My question's for Dr. Davila. It has to do with this issue of contact tracing. We're told that in some cases people are waiting several days before they get their sort of follow-up call from Toronto Public Health. And this obviously raises the question of, their contacts then aren't being alerted. Are there people who are potentially wandering around spreading the virus because this contact tracing hasn't happened fast enough? And I wanted to ask about that and what's being done to speed that up.
So thanks for that question. As I've mentioned many times at this table before, case and contact tracing is one of the cornerstones of public health work, particularly when it comes to managing an infectious disease outbreak, and certainly managing COVID-19 is no exception. We do stratify from a risk perspective in order to direct our resources in the most appropriate fashion. Again, we can't be every place simultaneously. It's just a challenge with respect to, managing resources, but you do want to make sure that we focus our efforts on those cases and on those contacts that are highest risk in terms of continuing spread of COVID-19. So I can assure you that we have deployed significant numbers of staff. We've introduced new information technology to support better and more efficient case and contact tracing. I have, however, said that this is it is very labor-intensive work, and it does take quite a bit of time to do. Hence, every little bit that we can put towards increasing our efficiency becomes very, very important. But we do stratify, and we are deploying technology to try to get this work done in as efficient and effective a manner as possible.
And just to follow up then, rather than triaging or stratifying, is there not a way you could bring in a whole bunch more staff? The Nurses Association says they have tons of retired nurses and nursing students who could be brought in to do this work. Why not sort of staff up and scale up in a big way to get more of this work done quickly?
We have absolutely done that. We have redeployed staff from across our department. We've brought in volunteers. I've mentioned previously at this table we've brought in medical students and faculty from the University of Toronto School of Medicine, and we're continuing to do that. People do need to be trained onto the system and trained in terms of doing case and contact investigations. As I've indicated, this is really important work, and it does take some time to train people in order to do that. So I can assure you we are putting an incredible amount of resources towards doing this, because we know that this is one of our many unique value adds to the whole system, and it is one of the most important roles for us as Toronto Public Health.
Okay, thank you. Last question now to Brian Passafume from the Toronto Sun. Brian?
Good afternoon. My first question is about the bike share program. What's the plan with that program? Is it going to be continuing? And if so, what precautions are being taken?
Well, I can tell you, yes, the program will be continuing because we believe it's another important way in which people can get around the city, and that is important, that people should maintain mobility options during that time. They have engaged in enhanced cleaning efforts as part of the daily maintenance routine for the bikes, but we are saying to people who are using those bikes to please plan yourself on taking additional steps to disinfect the bikes. In other words, bring some wipes with you and wipe the bikes down, ideally before you use them and after you're finished. But they are taking enhanced steps to be cleaning the bikes, and we would urge people to do the same thing so that we can, minimize what is probably already a minimal risk that the virus in any way would be living on those bikes.
Okay, thanks. I'll get one quick follow-up. What's the status of the city's roadwork program? Will projects be moved ahead, or are they going to be delayed due to the outbreak?
You said the roadworks programs?
Yeah, like pothole repair and like the usual spring maintenance stuff.
We are actually doing what people have suggested a number of times that we do, and we're now having a meeting early next week to look at whether there's an opportunity to accelerate some of these programs because of the reduced levels of traffic that are going on during the time of the close down of the city. So I would expect you might see, subject obviously again to public health considerations, where we have to make sure that the workers that are doing that work are safe and are able to maintain physical distancing. We're going to look for some opportunities to see if we can do some of that work while things are slower, and we'll have to see how many of those fit that bill, including in particular the all-important matter of safety.
Okay, everybody, thank you very much for attending. There will be no briefings over the weekend. However, we will issue daily updates on case count numbers. Have a safe weekend, and we will talk to you again on Monday.